Hi, I'm Dr. Crystal Coyne, the chair for the Prescription Drug Advisory and Action Council through Drug Free Charlotte County and a local community pharmacist. In observance of International Overdose Prevention Day, I'd like to talk about naloxone, an opioid reversal agent, or what I like to compare to another life-saving device, the fire extinguisher. Throughout the U.S., we've seen a decline in the overdose deaths due to the expanded access of naloxone. Narcan nasal spray is one form of naloxone. And here in Charlotte County, Florida, the life-saving Narcan is administered in most cases of overdoses, and the fatality rates are drastically different. Did you know that you, yes you, can get Narcan from your pharmacy? Of course, the best prevention is to not misuse or abuse your medications, to keep them stored safely. Early intervention is another key. However, as a pharmacist, I will focus in the last measure in this chain. What to do if there is an overdose. Think of Narcan as a fire extinguisher. We all have at least one in our home. You've probably never used it. However, as soon as you see that it's going to expire, you get another one. Why do you do that if you've never used it? Well, we do that to help save our life, the life of our loved ones, and the life that we've built. And an opioid reversal agent does just the same. So remember, opioid deaths are not just from taking too many. When we're in severe pain, sometimes it's hard to remember if we've even taken our medication because we're still in pain. So you could accidentally take a second dose. You could start a new medication that causes a drug interaction in which your opioid builds up in the system, causing an accidental overdose. What about family with small children that come over, maybe a dropped pill on the floor, or looking at your medications like candy? And sadly, family and friends steal these medications often. What if a teenager takes a whole handful? We never know what may occur, but I choose to save my life or the life of another. Those lives are much more valuable than the cost of Narcan. So let's discuss how Narcan works. Again, Narcan is just one of three ways that this is available. So it's a nasal spray. It's designed for anybody to use, no medical training needed whatsoever. You don't want to hide it. You want to make sure everybody knows where it's at in the house and how to use it ahead of time. So as soon as there's a sign or a symptom of an overdose, use the spray, even if you're unsure if it's an actual overdose, because an opioid overdose can cause horrible side effects long term, including death. The Narcan does not. So some signs and symptoms that we want to look out for is difficulty rousing somebody. So if it looks like they're really tired, it's hard to get a response, and you're talking loudly and you're rubbing on their chest area and they're just not waking up. Shallow breaths that are very slow. If somebody has their pupils that you see little pinpoints and they're difficult to arouse, that combination is also another sign. So at that point, we want to go ahead and get out our Narcan. So I don't have a demo with me, I'm sorry. It's a very small device. It's white and red. So you just put your finger near the spray, and then the bottom has a red plunger. So you would hold it like this, and then you put it into the nostril of the person that is having the suspected overdose, all the way until your fingers touch the nostril, and go ahead and pump that red dispenser there. The person does not have to inhale. Again, no medical training required. If you haven't called 911, somebody else hasn't already called 911, now is the time to do it. Often patients will actually start to revert and see some signs and symptoms 2 to 3 minutes later. If that happens, we go ahead and give another dose. In the meantime, we're calling 911. We might have to do CPR, rescue breathing. We can handle all of that at the time. So we really just want to make sure we know how to use it in advance so we don't panic. All you have to do to get Narcan is ask your pharmacist. So over 50% of plans cover the medication fully, and those that don't, it's still often under $20. So I think my life is more valuable than that. I know yours is as well. So go ahead, ask your pharmacist, see how much it will cost you, and really consider keeping that on hand to help protect you and your loved ones. Thank you.